Dr. Labos, let me get your reaction to the plan to gradually reopen in Ontario and allowing, I guess, non-essential businesses to open to limited capacity, but even in the hot zones.
Yeah, so clearly it's a calculated risk. I think we have to acknowledge that the minute you start opening things up, the minute you start having people going to stores, gathering together, even in small groups, there is a risk that you can spread the virus. So I think we're going to have to be mindful of the fact that if we start to see the numbers go up, once things open back up, it's very likely that things are going to have to get shut down again. So we have to realize that even though things are better now, they're still not good, and there's still a long winter ahead of us where things can get worse.
Yeah, and they even talked about the variants and the rising concern with more cases of the variant being detected in Ontario. To that end, they now have a break mechanism so that the medical officer of health in the province can consult with other medical officers of health to shut things down. Again, it seems like a safeguard. Is that smart?
Well, it's necessary. I mean, if you start to see the number of cases going back up again, if you don't do something like that, we'll be back in the situation that we were around Christmas time, with hospitals being overwhelmed and the healthcare system showing signs of strain. So if you don't have that type of mechanism in place, you'll just undo all the good work that has been done over the past month. So I think people need to sort of reconcile themselves with the fact that if we are going to contemplate opening up businesses again, there might be a back and forth. It might not be a smooth trajectory going forward. There might be an open up, shut down cycle until we can get enough of the population vaccinated that we have some degree of population-based protection against this virus.
Is the messaging, I mean, is it clear, do you think, to people? And I'll use Ontario as an example because obviously there's reopening plans underway in other provinces in the country. But when in Ontario, we're going back to a different framework that we were in before the color coding. And a stay-at-home order essentially means don't go out for non-essential reasons, but there's non-essential retail open. And so if you're under a stay-at-home order, you could go there, but you shouldn't.
Yeah, well, I think you've put your finger on the sort of the critical problem here. It's the messaging is don't go home unless you, and it's like stay home unless you have to go out, and if you have to go out, then you can go shopping. So it's obviously confusing for people. It's confusing to me because the problem is the minute you tell people that you are allowed to do something, people interpret that as it's safe. I'm going to go do it, and it's not quite safe. There is still a lot of community spread of this virus going along. So if you don't have to physically go do something, don't do it. Do it online. Do it remotely. Do it from do it online. Do it over the phone.